After spending nearly 1 month in the hospital, more than 2 weeks of that on a ventilator,
I'm just thankful every day that I'm here.
a clinical trial using the rare disease drug Solaris to manipulate her immune system is what Troy respiratory therapist Amy DeVos credits for saving her life from COVID-19.
I still feel a little weak. I'm getting some PT and OT to help me get stronger.
As DeVos works to get her strength back, researchers continue trying to understand how COVID-19 will impact all patients' bodies long term.
It tends to have preference for the lung tissue.
But Miami Valley Hospital's Chief Associate Medical Officer, Dr. Roberto Colon, says the latest research shows COVID-19 is also causing heart inflammation.
It's a myocarditis or a carditis, and that appears to cause some of the heart dysfunction, where the heart doesn't seem to be pumping very well.
The New York doctor, Tom Pitts, who started DeVos's clinical trial treatment,
He's my angel on earth.
says the research also shows a correlation in 3 areas where COVID-19 is causing heart attacks, including septic shock, inflammation of the sac around the heart called myocarditis, and the body's immune response causing the lungs not to send out enough oxygen.
So you're not able to perform the work that is the physical work that is required to circulate blood under these conditions throughout your body. Your heart goes into an arrhythmia.
Dr. Pitts said if DeVos had not received the clinical trial's medicine, she would have died.
So eventually it would have been her heart that gave out.
Dr. Colon said COVID-19 patients are also experiencing problems with other organs like the liver, the kidneys, and some of the intestinal areas.
And we don't yet know if that is a direct impact of the virus infection in those organs or the illness associated with severe manifestations.
Colon says he expects ongoing inflammation problems, similar to other coronaviruses like SARS and MERS, to be COVID-19's long-term impact. While the majority of those patients eventually recovered, the doctor says those who experience more severe symptoms could deal with long-term lung disease.
Fibrosis within the lungs is usually irreversible. It does not go away. That's when the lung heals with fibrous tissue because of inflammation.
But with her history as a respiratory therapist,
My lungs were terrible. That is all resolved. My lungs are clear.
DeVos is confident she'll make a full recovery.
And I feel like once I get my strength back after I have some PT and OT, I'll be back to my old self. It's just going to take some time.
In Dayton, Ohio, I'm Molly Kowick reporting.